I don't think there are any studies to show how much fluoride gets absorbed through the gingival tissue, through the mucosa. They've done some rat studies. And obviously, if you lower the pH in your mouth, and there are some toothpaste that have got low pH, when you have hydrogen fluoride in your mouth, it will transmit or cross the mucosal border and absorb. So nobody's actually measured how much fluoride absorbs from toothpaste. Obviously, if you increase to a much higher concentration like Prevident, it's 5,000, it's neutral. It should still be okay, I guess, in terms, as long as it's topical, you still spit it out. There's going to be a whole bunch that is retained in the vestibule, in the, on the teeth, on your tongue, and we've measured the fluoride that stays around. It takes about 12 hours for the fluoride to come down to about 1 part per million in your saliva after toothpaste, regular toothpaste. So for topical fluoride, it would be 3 or 4 days before you get down to 1 part per million. And if you use an APF, an acidic gel, then it's going to absorb through the gum tissue and into the bone. And that could be one of the reasons why there's extra fluoride in the bone from APF gel. Does that answer your question?
So you would still consider over-the-counter fluoride safer than you would still consider the over-the-counter fluoride toothpaste obviously safer than ingesting fluoride, but safe enough? I mean, it's just a risk-benefit ratio.
Yeah, it's a risk-benefit ratio. If you think you're providing a benefit to a high-risk patient and they're on topical fluoride toothpaste, then great. The general population, I don't think, benefits even from toothpaste in the non-fluoridated areas. Good oral hygiene and good diet is all you need.
Thank you. And again, the question is for Dr. Lineback. The World Health Organization criteria document, all of their opinions are expressed in numbered documents. And so the official opinion of the World Health Organization, do you have a number for the quote that you gave representing the World Health Organization?
No, I don't have a number. David actually said I'm going to ask that question. To go to find the number, and there probably isn't one. What I probably am susceptible to, and in that slide that I showed at the end, was the response from the Ontario Dental Association and the Canadian Dental Association, and probably the ADA as well, in terms of misrepresenting the WHO's position, World Health Organization's position. So I suppose that if there isn't a criteria, then the dentists are basically misrepresenting what the World Health Organization's position is. So thanks for the question, David.
I've got another question. Dr. Lineback, again, you mentioned MI paste this morning. We have lots of natural or holistic patients in our practice, and they object to the other chemicals in there. Is there a substitute for MI paste that you know of, or is there I was in a conference once when some dentists suggested that placing cheese on a sensitive buccal area would reduce the sensitivity or recalcify. Does that make any sense to you? Or?
Wonderful. In fact, some of the original studies were done at U of T, and I helped the PhD student who was doing the research. We first started looking at cheddar cheese, and it is an amazing remineralizing substance. Cheaper. Much cheaper, yeah. And that's where they isolated casein, phosphopeptide, and then with the amorphous calcium phosphate. So Reynolds basically got funding from the dairy industry in Australia, funding from the government. They all got together and got this patent, and now, of course, it's being sold at GC at horrendous prices. What is it, $139 for 10 tubes or something? So, yeah, use a piece of cheese.
Any more questions? You're allowed to get this.
Again, this is for Hardy. When you talked about fluoride varnish, I'm curious, has there anybody ever studied effectiveness of fluoride varnish versus varnish without the fluoride? In other words, does it work because of the fluoride? Does it work because of the varnish? Or does it really work at all?
Apparently there are placebo-controlled studies. So they do put the coliformium resin, I think it's called the coliformium resin, I'm not sure if that's the right pronunciation, as a control. And that in itself reduces the caries, from what I understand from those clinical trials. I'm not sure if the difference is that big, and I'd love to see substitutes for fluoride varnish like chlorhexidine varnish, or even something better than fluoride varnish. There haven't been any head-to-head clinical studies, chlorhexidine varnish versus fluoride varnish, or fluoride varnish versus MI paste. No head-to-head studies that I know of just yet.
There's a new product out called Denclude that claims to have some efficacy in some of these root caries and sensitivity. And I think arginine is the active ingredient. Are you familiar with that at all?
No, I've never looked at their studies. There are other amino acid-rich products, Oratec, I can't remember, no, it's not Oratec. There are other products on the market that are being promoted based on their ability to raise pH. So, yeah, I mean, sure there's that other approach.
Thank you. This is for Dr. Vera. I'm still a bit confused about the role of mercury and heavy metal sensitivity versus toxicity. And after I heard your talk today, I was refreshed about the usefulness of the ELISA test. For instance, I'm just going to ask this practical application. If a patient comes to you in my practice who's autistic, I'm an MD, I'm convinced that some children's autism is related to mercury, and I'm also convinced that some are not. If we were to run this test on an individual and find reactivity, a sensitivity reaction, would that individual be more likely vulnerable to the toxic effects, or are we really talking a distinct difference between toxicity and hypersensitivity?
We have actually done some studies on autistic children. So this is absolutely how you say. Not everybody is affected by mercury and other metals, and the metals which we found in the families of autistic children is very often nickel. Mothers, for example, had very often nickel hypersensitivity. They couldn't tolerate earrings. And the children responded not only to inorganic, to thimerosal, but also to inorganic mercury or to methyl mercury as well. But I would say about, altogether 30–40% of children maybe did respond to some metals. So what I would do is getting the risk factor up there, then I would probably go and see if I could down-regulate the immune system and see if it will help to the autoimmunity. For example, you can use different, I don't know, it's not used actually, but you can basically down-regulate inflammation by bioidentical progesterone, for example, or by chelation. So it gives you the possibility to concentrate on certain treatments if you see this. But
so the presence of a reactive test would be a good reason to be more vigorous in pursuing metal deprivation in these individuals.
Exactly.
But it may not be necessarily mercury.
May not be necessarily mercury at all, no.
Question. You have any more questions for our panel? Right here and right afterwards.
Just to follow up on that, you said 30 to 40% of the children reacted to a metal, mostly mercury. Was that of all children or just the autistic children?
No, I'm talking about autistic children.
So 30 to 40% of the autistic children that you saw were metal sensitive?
Yes.
Okay.
I just wanted to find out, is there a particular lab that does this testing or a variety of labs?
You can do visit on our website, which you got, and you see that the laboratory which is nearest now in Canada, Montreal, and then there is also our colleague representative in San Francisco, which will deliver you the kits so you can send the blood overseas. We are really hardly working on the issue to find out laboratories which will be nearby you, which will be located in America. And if you have any ideas in this respect, please contact me via email or here, so we can pursue this, because the situation as such is not ideal, because laboratories should get blood samples optimally within 24 hours. It's possible 48, but it's a time window, so it would be good to have a laboratory in USA for this respect.
Thank you. Any further questions for our panel? Bernard.
I just wanted to corroborate, the quick story, something that Rich Fisher talked about in his homeopathic seminar today. About a month or so ago, I got stung on my bicep, the inner bicep, and it swelled up like the size of the bottom of this glass. And it was huge. It was the entire inside of my arm. You could see the puncture hole, and it just kept getting bigger and bigger. And I was kind of in a panic because I just didn't know what to do. So I called Maya Guruswamy, who's a practicing naturopath, and I said, "Help! What do I do?" And she said, "Apis," which is what you talked about today. And I went to one of the Whole Food stores and got Apis. I think it was 30X or 60X. I've even forgotten which one it was. And she had told me also, just what you said in your homeopathic lecture, don't take it anymore if it works. And I took one dose of Apis, and it took probably 2 hours, and I just watched it shrinking. And all that was left the next morning was like a little hole where the sting was, a little mark, and a slight faint outline of where that swelling had been. And I promise this was huge. It was just very scary. So just wanted to corroborate that, Rich, and thank you a lot. I would even imagine most of the other stuff you said is 100% and the rest is 99%. I just wanted to, I felt that, my dental brothers and sisters are here, and I wanted to clarify something that's been in my mind, from listening to some of the, the speakers here today, and also from other experiences in life. And that has to do, with naturopathy in general, just so we as dentists and auxiliary staff should understand. There are only 5 schools of naturopathy, full schools, 4 years, of postgraduate work after college in North America. There are 4 in the United States. We have Bastyr, which is up in Seattle, and National in Portland. You have the Southwest College in Arizona, and you also have a college in Connecticut. And also, in addition to that, there's only one in the country of Canada, which is the Canadian College of Naturopathic Medicine in Toronto. When I was in dental school, I remember a very serious issue came up with denturists. Most of the people here know that word, what a denturist is. And I remember it was a big issue. These people were, lab technicians who decided that they could make partial dentures and full dentures, at least as well or better than, practicing dentists, and wanted, to be licensed, and they wanted, to be, and the American Dental Association, probably one of the few things that I could ever acknowledge that they ever did well, was, fought against it. And ultimately, the denturist licensure was, put down. I know presently in the state of North Carolina, there's a movement to, license. There's 14 states and most of Canada licenses naturopaths. And the biggest resistance are the lobbyists from the mail order correspondence naturopathic schools who people pay money and then they go call themselves naturopaths. And I just want to let everybody here know that, a naturopath is a naturopath graduating from an accredited school. And a correspondence person who calls themselves a naturopath is absolutely not a naturopath. And just like we wouldn't refer anybody to a denturist to make partial dentures or full dentures to our patients, And we also need to absolutely examine the credentials of anybody that calls themselves a naturopath to see if they have, in fact, graduated with clinical experience plus the academic experience of an accredited naturopathic school, which is only 5 in the entire continent of North America. So I just wanted to pass that on because the naturopath word just came up in my mind when I was telling Rich that I went to a naturopath for some homeopathic help, okay? Yeah.
Oksana.
This question was for Dr. Jaffe, but he's not here, and I'm wondering whether anybody else can help me with it. I've read a great deal about alkaline water to help alkalinize the body, in addition to foods, etc. Does anybody know good systems, and if so, what are the advantages and disadvantages?
Anybody care to answer up front? Stephen?
I don't know anything about good systems or bad systems, but I know that the electrical field separation of water into positive and negative ions, making alkaline water draws the negative ions toward one side, and it's going to concentrate fluoride as well as hydroxy ions. Well, if you start with RO water, maybe it doesn't have fluoride in it.
Questions?
Hey, I have a question on body chemistry in case somebody can answer. It has been told to me that if somebody has like a acidic oral pH, and they're probably acidic in other parts of their body, and the way to counteract that is with lemon juice, a weak acid, and it dumps bicarbonate. It just seems so counterintuitive to me that if somebody can explain how that works a little bit.
What lemon juice has in it is, of course, it has some of the major buffers. Citrates are one of the buffers in the body. And when you metabolize lemon, the final breakdown product in the body is alkaline. Now, it's not going to alkalinize the mouth directly because it's acidic in the mouth. So chewing lemons isn't going to make your teeth get stronger. But it will alkalinize the body to some extent. And you can do this like Russ was talking about this morning. If you take that pH paper and take some lemon juice, fresh lemon juice, in the morning, say maybe before you have any food, and maybe another, like a half a lemon to a lemon later in the day. If you do that consistently, you will alkalinize the pH of the urine, which will to some degree alkalinize the pH of the saliva. But it's an indirect effect because you're alkalinizing the body, which in turn, by supplying the buffers.
I think Sam Queen, popularized that. Actually has to be diluted in water. It's important, right, I think, to create a weak acid, and that stimulates bicarbonate secretion by the pancreas, which is the body's natural buffer to acidity. So all my patients that are acidic form lots of calculus, for example. I recommend that thoroughly to them, yeah. Any other questions for our panel this evening? Right afterwards.
This is for Dr. Jackson. You were talking about bisphosphonate, and I'd like you to compare that, if you can, to BPA, bisphenol A, which is also an estrogenic mimetic. And are there similarities other than that, or do you know?
I can't. The research that I did for the lecture on bisphosphonates was strictly for that, and I wish I could, but I am not knowledgeable enough to answer a question on the bisphenol A. I know that Michael years ago, when he was talking about the advantages of composites over amalgam, talked about the fact that the sealants that were unfilled compounds did not have the binders in there, that they would leak out the BPA, and that those were estrogenic or estrogen mimickers. But that's about all I know about that.
Yeah, Gene, I think you're confusing this. They're two different things. It's really two different, entirely different subjects. No, bisphosphonates are osteoclast inhibitors, as I understand, right? And it's a bone metabolism effect as opposed to a hormonal effect. Yeah. Well, I don't think you would use bisphenol A as an estrogen supplement. Yeah. Well, I don't think so.
Yeah, there's a writer who in Minnesota, where I live, who does a lot of research on the hormones and including the effects on the bones. And the bones do have there are impacts on bone health by thyroid and also leptin. And leptin is a hormone that was only discovered in 1995, I believe, but it has profound signaling effects throughout the body, best known as the hypothalamus. But leptin receptors are found in the bones and other vital organs in the body. So when somebody is recovering from jawbone surgery, their ability to recover and grow new bone is not just a reflection of the skill of the surgeon who did the work. It's also a reflection of that patient's general health, nutritional status, and hormonal status, hormonal well-being. So I think it's an important point to be aware of. And of course, a lot of these patients who are going through that kind of surgery are not very healthy people from a hormonal point of view. So not all of their problems in regrowing bone can be placed upon the surgeon who did the work. So, that's kind of still a short answer, but just to give you a little perspective, there is a connection between bone health and, of course, we can all agree that the bisphosphonates are a disaster for bone health. Fluoride is a problem for bone health. Mercury is a problem for bone health. But anything that disrupts the endocrine system can play into problems with bone health.
This is a question for Dr. Vieira-Steca. It was a surprise to me to see how toxic gold can be in your study. My question is, are we talking about the alloy, the dental alloy that we use in dentistry, or a 24-karat gold?
Yes, I always get this question. In our testing, in Malaysia testing, we only use 99% pure salts. And we try to use the salts which are used also for patch testing. For gold, it is usually gold thiosulfate salt, which is used. You can also use gold chloride, but they say in the patch test that it's quite often irritative for the skin. So definitely this is the substance. It's gold as such. Yeah. And you can also use gold cyanoaurate. Yes, this is another. It's an anion gold. So yeah, it's a gold as such.
Thank you, Barry. I have a question for Mike Jackson. I don't know if you addressed the study by Marks in 2007 that concluded that bisphosphonates, after 3 years of use, had reached their maximum potential in the human being, and that after 3 years of use, they would actually begin to create more problems as far as cavitations or JON is concerned. Have you addressed that, or have you read that, or have you read any other studies that corroborate that?
I've read that they say that it takes 3 years for the toxic levels to build up to the point that in the oral bisphosphonates that you start seeing the spontaneous bone sloughing and the osteonecrotic bone showing. Excuse me. And some of the researchers are starting to suggest that going back and forth, taking the medication for a certain while, get the level up to do what the drug is intended to do, and then stop. Because with a half-life of 10 years, you don't need to continuously be taking it to get to the level of downregulating the osteoclastic activity. So I've heard of that, where they're talking about taking it for a certain length of time and then getting off of it for a length of time so that the amount of toxicity doesn't get beyond a certain point. So you get the therapeutic use that they're looking for without building up a great deal more. But I'm not sure if that answers your question or not. I've read that.
Thank you.
Question for Dr. Lineback. Have you seen any relationship of fluoridated areas versus non-fluoridated areas having more of the jawbone problem?
That's a really good question. There are some people who believe that mandibular tori are larger in fluoridated areas. No, there aren't any studies to look at bone differences other than the studies in India looking at bone spurs in stage 2, stage 3 skeletal fluorosis. So in North America, where we only have 1 part per million fluoridated areas or naturally occurring areas, there are 200,000 people exposed to 4 parts per million and more in America, and they do have problems with their bone. And nobody has actually looked in the oral cavity to see if there are bone exostoses in the fluoridated areas, and it's a really good question. I think there is a difference. And I think people who get a lot of fluoride treatment actually grow more bone, especially if they're bruxers.
Have any more questions for our panel this evening? Maya.
This is for Mike Jackson. Unfortunately, I was not at your lecture, so but I'm a naturopathic physician, licensed in Canada, and so I work with a lot of women with osteoporosis who are on the bisphosphonates. And as I understand it, the problem with them is that they are osteoclast inhibitors, and so they block all metabolism in the bone. So they block the breakdown, but also the building. And what I've found useful in my practice is strontium as a mineral. And it is used as a pharmaceutical in Europe for osteoporosis. And what's really striking is that there are studies to see actual bone rebuilding and not just stopping the loss of bone. Have you heard of that mineral or have any experience with it? Or I don't hear about it much. I was just wondering.
Actually, not in the literature that I read for the bisphosphonate. They were not talking about strontium at all. I do have chiropractor friends that have suggested that using vitamin D and calcium as an alternative to bisphosphonates, it's their opinion that we should try that first. In one of the articles that I read, one of the docs said that that did not significantly show any improvement, but I did read an article where they were comparing Fosamax by itself, Fosamax with vitamin D and calcium, and the vitamin D and calcium by themselves. And if I interpreted the study correctly, the worst of the groups was the Fosamax by itself in terms of promoting an increase or a decrease in the bone mineral density, and that actually the calcium and the vitamin D by itself was as effective as when they mixed the Fosamax. But that was just one study that I can recall.
Regarding the osteoporosis, I am also involved in a lot of teaching on metal toxicity in so-called anti-aging medicine. And what is clear is that you can improve bone density by bioidentical hormones, and especially by progesterone, which will turn down the inflammation, and low doses of testosterone, both in women and men. So there are basically no side effects if it's monitored properly. It has to be bioidentical, not synthesized progesterone. And if you just talk to apothecure, for example, they can tell you about the doctors which knows that. I don't know if they're... Yes, exactly.
I can comment about the question regarding strontium. We've been using it in our practice for about the last 5 years, and there are studies going back to use of strontium back to 1940s, Columbia University, Harvard University, where they've used the strontium ranelate, which is a form we can't get in this country, but the strontium citrate actually does work, and the use and the vitamin D, of course, is important, but most people, and we test almost everybody for vitamin D levels, and most, I'd say 90% of the patients that we test have too low of a level of vitamin D. They need to be over 50 nanograms per milliliter level of vitamin D. But the strontium itself, by using 750 milligrams of strontium a day at a time different than the calcium, will actually increase bone density on the average 2% per year. And we've done enough serial bone densitometry tests now on patients and have seen that quite across the board. It really is much more effective, I think, than the bisphosphonates without any adverse effects.
I would like to comment on that also, because a number of years ago, Harold Crystal spoke to this group and talked about metabolic typing for nutrition. And Dr. Crystal did a lot of research that showed that certain people would do better, for instance, on calcium if they were having bone loss, osteoporotic results of lifestyle, the way they lived. Other people did better on things like magnesium, silica, boron, and so on. I think with vitamin D, now that's been thrown into the mix. I've actually seen patients that I've had come into my clients, let me call them now with nutrition, let's call them clients, but they will come in and they have had a DEXA scan, they're shown to be becoming osteoporotic, the physician puts them on calcium, 6 months later they're still worse, they put them on more calcium, pretty soon they're up to huge loads of calcium. Then they'll go over to Fosamax and they keep getting worse. And I've actually seen clients I've had come in and I say, okay, something's crazy here, let's stop all that stuff right now, and I'll switch them over to a different mixture, for instance, magnesium, the silica, the boron, the vitamin D, and they get better. I mean, really quickly. It's phenomenal. So I think Crystal had it right. You can see that if you go to bloodph.com, his original articles are on there. He's been long gone now. But I think that bone formation, bone density is a really difficult proposition. And I think that it's not so simple to just look for one answer or another. Vitamin K has now been thrown into the mix by people like Sherry Rogers. So it's a difficult thing. You've got to go back to a very healthy diet, again, lifestyle, what we talk about over and over, and of course toxicity.
This is more of a comment than anything else. Some of us in the Academy have been very interested in some of the newer emerging alternatives, and I've had several patients in the last couple of months be concerned about the bisphosphonates and the risk of losing a tooth and the length of time they were on the bisphosphonates, et cetera. And I think we're dealing with several things. We're dealing with the sensitivity of the teeth, we're dealing with root caries, we're dealing with root canals, we're dealing with periodontal disease. And one of the things that really, or several of the things that really seem to fit, that I think from a triage point of view is helpful for the patients, is using the irrigation and the microscope. Number two, the laser that we talked about last year with LANAP therapy, where we can get reattachment, new bone, new ligament, new cementum. And the third thing, which has been really very promising that Phil Malka's been using, is ozone therapy, because the ozone therapy will help with the circulation of the tissues, help with the healing. It'll kill the microorganisms in there. It'll also help with the sensitivity. So just a little comment.
I think in the literature they were saying that in people that developed the bisphosphonate jawbone osteonecrosis, that it was probably 80% or so of those had active burial involvement as well. I didn't mention that.
This question is for Dr. Lineback. I'm not quite sure what I want to ask or how I want to phrase this, but I'll just see how it comes out. As I understood your lecture, you know, we have to be concerned if there's 1 part per million of fluoride in our water versus 4 parts per million. But you also say we have to be concerned with the quantity that we ingest. So if you mentioned the example of the athlete who's using copious amounts of liquid to hydrate himself. It's been my understanding that the average person, well, in North America, but probably worldwide, is underhydrated. And so it's always been my, I advise people to drink more. Mm-hmm. And now after hearing what you're saying, I'm saying, is there a little bit of a, where's the balance between being properly hydrated and being overly fluoridated? And then when you talked this morning about things I didn't realize, which is that manufacturers are now taking our vegetables and doing whatever they do. I don't know if they're spraying them with fluoride powder or whether they're dipping them in a fluoride solution, but you indicated that they're being treated with fluoride, presumably to keep them fresher for longer. What do we do about that? Is it possible to get that off of the vegetables? It can wash off, or is it incorporated in the skin? What can we do to protect ourselves from this? Because fluoride is such a small molecule, it's hard to filter out of our water. It's hard to do anything with. What are your recommendations?
Well, if you're worried about how much you've got in your system and you want to get rid of it, it'll take a while to get rid of it if you reduce your fluoride intake. So the tricks to reduce your fluoride intake would be to start drinking pure water. And if you want to rehydrate, if you're an athlete and you're taking in 4 or 5 liters a day because you're working out, then you got to drink pure water. A lot of people have asked me, well, you know, the naturopaths have say you have to drink mineral water because you don't want to lose mineral if you're drinking distilled water. I don't know if that's really true, that you lose too much mineral from drinking all that water and then urinating out mineral. I'm not a naturopath, so I don't know if it has a huge effect. But if you want to stop the fluoride from accumulating, you got to stop taking it in. The foods that are rich in fluoride are things like, I mentioned kidney, there's also deboned chicken. Your kids who eat, probably nobody here will let their kids eat McDonald's nuggets, but it's made from deboned chicken meat. And the bone is very high in fluoride. So when you grind off the meat and debone it and make processed meat, you have a lot of fluoride in that meat. The tinned salmon, you see the bone in there. It's already boiled and it's already lost its fluoride. And tinned salmon has 22 parts per million fluoride. You can get fluoride from fish soup. You know, a lot of Chinese people will make fish head soup. They just cut off the head and make a fish head soup out of it. There's a lot of fluoride in that. There's fluoride in, as I mentioned, tea. So even if you go to distilled water and you're using distilled water or reverse osmosis to rehydrate yourself, if you also take in other sources of fluoride in your food, you're going to keep taking it in and you'll never get rid of it. There's always that turnover in the bone. If you want to get rid of it altogether, you have to stop exposing yourself to high amounts of fluoride. And the vegetable question, yeah, they're putting chemicals on vegetables. David, I'm sure he can corroborate this. In California, they're using things like cryolite, which is a natural fluoride. And they can even say it's organically grown vegetables if they put cryolite on the surface of the the grapes. California wines have got fluoride in it because of the grapes with cryolite on them. Vegetables that are treated with cryolite, and even the vegetables that you get in the grocery stores. Up in Canada, we have the vegetable counters that are constantly being sprayed to keep the water fresh, or keep the vegetables fresh, right? They're using tap water to do that. So just imagine if it's being done all day long and the water evaporates and it sprays again. Each time you reach in, it stops, but it keeps spraying all day long to keep the vegetables fresh. That vegetable, that surface of the vegetable is actually increasing in fluoride concentration because of the evaporation of the fluoridated water from the tap water. So what you do is you take it home, and you actually have to wash your vegetables quite thoroughly in low fluoride water. And there are organic products that are available at health food stores where you can wash your vegetables and get rid of the fluoride. And best thing to do is grow organic vegetables and buy organic vegetables because they don't use the toxins.
So sorry to pursue this a little bit, but in this room we have a certain level of understanding after having heard this. I am an athlete and I do drink low fluoride waters and that, but we all see patients every day and clients every day who don't have this understanding. And this morning I heard Vera say, if we get the right experimentation going on, amalgam will be banned within X number of years. To you, I say, what can we do about, and I'm not putting on your shoulders, but it seems to me that we have our patients coming in and we're trying to help them with amalgam, and now they're being toxified with fluoride. My goodness. It's like I say, we live in this collective haze of mass insanity in this world. I just don't understand it, but there it is. But it seems to me that there needs to be a certain amount of experimentation done and pressure put on governments to say this has got to stop, because where our health systems go, we're trying to fix people, and as soon as we try and help them, other stuff is coming in to degrade them. And I don't know the relationship between fluoride and amalgam and how they might synergistically work in the body to
we never looked at
cascade.
that. On the committee, we didn't even have a chance to look at the effects of other elements on fluoride and whether or not they could be toxic. And so there's a huge area of opportunity for research in the future. And the NIH even asked for more studies on fluoride. So it's not like they don't want to look at this. They do want to look at it. But the question about why can't we ban fluoride, and follow up on the whole mercury issue, it'll be easier to get rid of mercury fillings because everybody knows mercury is toxic. It's going to be harder to get rid of fluoride because dentists and doctors, even the doctors here might corroborate that, doctors also think there's a benefit to fluoride. So if there's a benefit to a product, it's hard to get it out of the water, whereas opposed to something like arsenic and mercury, we know it's not supposed to be in the water. I mean, there's no benefit to having mercury in your system, right?
Well, I'm a new member of this academy, and I was noting that it's a small academy, but then I remembered that dynamite comes in small packages, and as Margaret Mead said, never doubt that a small group of committed individuals can change the world because it's the only thing that ever has. And so I would put the challenge to the academy to continue at their fine work and take fluoride, a little bit more under your umbrella and say, let's go to work, because you are having an impact on what's happening with mercury.
Thank you very much. We may not have authority, but we do have some power. Thank you. We'll take one last question, and then we'll go for the cocktail this evening. I'm sorry, there was one gentleman up here, and he didn't have a chance yet.
It's just a general comment, going back to one last week. Last month, a patient died in England, hit the newspapers, for drinking too much water, and they were in a fluoridated area. A naturopath was telling them you have to drink water. The detox, they got into problems. He told her to drink more water. Started to suffer, drank more water, the patient died. But nobody picked up on the fluoride side of it. They were saying you're just drinking too much water. Secondly, you're saying about the vitamin D and calcium. There's research showing that you have to take vitamin A to be able to absorb vitamin D at the same time. If you don't take them, you don't absorb the vitamin D, and vice versa. And then talking about the treatment of osteoporosis, sometimes it works with the calcium and the vitamin D, sometimes it's the magnesium. You have to go back to looking at why the person got the osteoporosis in the first place, which goes back to psychoimmunoneuroendocrinology. You have to look what's in the history of why the person had the thing in the first place and go back and reverse that before they can heal. If that's anything you say.
Mike, there we go. We have to cut this now. It's almost 6 o'clock, and we do have our welcome cocktail in the atrium waiting for us. I'd like to thank everyone that stayed for the question period, and I'd especially like to thank our speakers today for presenting excellent material like they always do, and for staying this evening to answering our questions. Thank you so much, everyone.